Good morning. Happy to be here today. Part two. What I think we're going to do a little bit of is to kind of just reach back and kind of briefly cover a little bit about what we talked about last time we met. I think this lines up pretty nice with the safety net, rollout of the safety net proposal. So the logic model is kind of the central piece of that proposal. And we're going to talk today about identifying measures and indicators that's highly associated with your programs to help you watch your progress. Talk about outcomes measurement, what and why. I think this is an important conversation to have. We live in an increasingly faster and faster society with more and more data available, and I think we have to stop and ask why we are collecting the information we're collecting. So we'll talk briefly about that. I struggled in putting together this training to try to tell a linear story about relevant information and not get lost in the forest for the trees, so to speak. But I cannot get away from talking about single system designs and what it is that we need to do as programs to actually evaluate whether we're being effective or not. And so we do need to talk about design and some research concepts that apply to evaluation and provision of social services. We'll get into measurement. I will tell you right now that this is a difficult situation also because there are a lot of different services in here. And so, it's hard for me to really say, here's a measure for this and here's a measure for that. I will say that I've created in the handout that you've got a packet with some internet resources that will point you to some freely available measures. There are many freely, publicly available measures that are out there, as well as measures that you can find through research studies if those studies are relevant to the kinds of programs you're trying to evaluate. And I think that you don't have to use existing measures. I met with the Boy Scouts the other day and just looked at the program that they're actually implementing and what it is that they're doing. And sometimes if we just try to quantify a few of the things that we are currently doing, it's enough to really capture a picture of an accurate indicator of what it is that we want to communicate to funders and stakeholders. I'm going to talk about the strategy and skills associated with connecting the logic model from Module 1 with a measurement model. I think there's an effective way to think about this when you're writing a proposal, either for the United Way or for Indie Funder, that will help you in communicating what it is that you're doing with this information, because it can get a little fuzzy when you just write it down in a narrative. I think tables and using tables to connect the two, the logic model and the measurement model, can really help. And a few caveats and considerations that we'll talk about before we close today. At any point today, one of the big pieces of feedback I got from the first training was that I used some $5 words. Thank you for that, Peggy.
I only know 250. So.
Well, what I want to say today, I was a principal, I was a teacher, I was a school social worker, I was a direct practitioner for many years. And in order to get a PhD, they made me stick my head in a book for about 5 years straight. And it's definitely affected my language. Please interrupt me if I use a term or something that is not clear, and I'll try to be careful and provide examples as I go along. But I want you to interrupt me and say, whoa, wait a minute, back up, define that, or give me an example of what you're talking about. If we can do that, then I think we'll clear up and use some common language today. Overview, and again, stop and ask questions about Module 1. So this is an overview of what we covered, all the way back in January. Here's the overview of the training modules as a whole. So the first module really looked at the what question of program evaluation. And we talked about logic models. The logic model is a form or a table that helps to clarify what it is that you want to do with your program, connects the program activities to the meaningful outcomes that you want to achieve, and is just a way to communicate that in a clear fashion so that your funders and stakeholders know what it is that you're doing. I think a lot of times one of the problems with social services is we experience mission creep all the time. Nick and I talked about that a couple of weeks ago, And I think that sometimes the logic model really forces us as folks running these organizations, these programs, to really say what is it that I am doing, why am I doing it, and how does it actually logically link to meaningful outcomes. So a good tool, and Hani will send that out to everybody. I haven't actually watched it. I'm not sure I want to, but the resource will be available there, so that's nice. Today's module is really the how of program evaluation. Really, the heart of the matter and the performance measurement movement is collecting data, meaningful data that communicates what it is that we're doing and what's the impact of it. And then the next module that will be next month will be the why of program evaluation. This is then communicating the information that we have now collected this data, and at that point I want to provide some strategies and resources that will help you think about setting up your own database, for example, either using Excel or Access if you're comfortable with that, how to present some of that information in terms of what you need to communicate to funders, how you can set up some simple frequency tables, how you can produce some bar graphs, some pie charts that will communicate the data that you have collected, some simple statistical tests if you do want to do that, if you're comparing groups, for example. So that's the 60,000 foot view of what we're trying to accomplish here, alongside of rewriting the RFP and the way that we grade the RFP. So in Module 1, we reviewed the logic model. We talked about the inputs, the activities, and the outputs and outcomes. And I talked about outcome change. This has led to some very interesting conversations, especially with Safety Net, that I've really had a lot of good feedback from folks on in terms of what they think. The goal that I walked in here with was to increase your knowledge. This is a training. This is really an intervention of some sort. Anything educationally related is an intervention when you're teaching somebody new concepts. It's important to measure knowledge before you give the intervention and then after you give the intervention. So I had a pre and post test. Not everybody filled it out. If you haven't, there's a pre-test in front of you. Please do that. It'll cover some of the content that we're going to talk about today. And there's a post test just to see if your knowledge about these things change as a group. What I saw was that of the pre-tests that were finished, 24% actually correctly identified the elements that I laid out and put them in the correct boxes, the input, activities, outputs, and outcomes boxes. After I finished, 72%. That made me feel really good. But there's some problems with that data. I don't know who in here filled out the pre-tests and who filled out the post-tests. I didn't have the numbers linked on them. So these are the kinds of administrative problems that we run into when we collect data and we try to really show that we have had a change, or that what we've done has resulted in a change. That was an administrative error on my part. If you'll notice today, there's a number in the upper corner of your pre-test and post-test that match, and it will allow me to look at within-person change as well as across-person change. We learn. It's a process. This is never, ever, ever a product. It will never be finished, program evaluation. We're always refining it. Did we have any questions, burning questions from the logic model before I kind of just review briefly a couple of the slides from that? If there are, please jump in. So really, when we think about program, we think about the phases of program evaluation. So the planning, the implementation of a program, and then the actual maintenance, or the carrying on, which includes evaluation. This is what we call in education formative, which is a process evaluation. Formative evaluation has helped to inform us about what it is that we are doing over time. If we do not see the changes in the scores or the data that we want to see, then we know we need to change something about the process of what we are doing. And that's why we call it formative. The summative is really the outcomes evaluation. It's a summative evaluation of what it is that we have done. What we know is that we can gather from a community needs assessment and list the priorities that are associated with the problem that we are concerned with. Stakeholders, who does this problem affect? How many people does it affect? What are the What are the conditions that people experience as a result if we don't intervene? This allows us to understand and build a program and list inputs of things that we need. When we're listing these inputs in a logic model format, and we directly connect these things in the budget, I mean, literally, these should be line items in the budget. All of these inputs should be made available to conduct activities, or the program activities that we hope will change or alter the issue that we're concerned with. Outputs is really about measuring the units of service that we provide using those in those activities. So it's the number of people served. If you're the food bank, the number of units of food passed along. You name it. Think about your own program in that respect. It's important to monitor this information, not only to report to individuals how many people you serve, but also to let yourself know, and it helps to build budgets into the future. I mean, this information is important. If you're seeing an increase in certain, like many agencies, if you offer multiple programs and you see an increase in one of your programs in terms of individuals that are accessing it, then you might need to think about the budgetary issues associated with that the next funding cycle. So this is where the process evaluation, those three boxes are important for process evaluation. And then the outcomes. This is where the money is, so to speak. This is what funders want to know about. I mean, let's be frank about it, folks. The information that you're being asked to collect is top-down driven. Right? I'd like to change that attitude. So as a principal, I measured a lot of things in my building because it informed my direct service to kids. In education, we used to do pre and post tests to understand where a child's knowledge was at on basal word scores. And then we would teach them those areas of deficit, and then we would conduct a post test to see if we had closed that gap. What we did with No Child Left Behind was blow that concept out of the water. We haven't reduced the achievement gap. We haven't improved overall academic functioning of kids with that approach. But what we have done is gotten away from the very basic fact that the data being collected should have been informing direct instruction of children. And now it's about closing schools or identifying high-performing schools. We've taken it away from the kids, and that's why we're not seeing a change. So I think the outcomes evaluation, the question that we've got, the hard question we've always got to ask ourselves, besides the fact that we need funding and how can I please my funder, whether it be United Way or whomever you're applying to for dollars, the question still needs to be, why am I collecting this data? When we talked about outcomes, we talked about a developmental sequence of outcomes, starting with short-term or proximal, or otherwise sometimes known as immediate outcomes, sometimes known as initial outcomes. Is that the term we're using with the logic model? Initial, right? Initial, okay. These are changes that are immediate at the point of service that should be expected to change logically if the service is provided as designed. What is it that we want to achieve? That's the question you got to be asking yourself on initial outcomes. Typically, we measure this in terms of changes in knowledge, or if it's an intervention, maybe an attitude that we're hoping to change an individual's attitude about a particular topic, or retraining individuals in the way they think about problems cognitively. So pre and post test of knowledge is an initial outcome. That would hopefully indicate in what we call interim, sometimes medial, otherwise known as intermediate outcomes. This is a developmental process. If we change individuals' knowledge, will that lead to a change in behavior? This is a little bit more of a concrete issue. Will it lead to a development in skills? I do see a lot of folks that talk about logic models that say that skills are proximal outcomes. I disagree. Like, what is like skills? What's required for a skill? Like, think about a skill. Let's maybe think about pottery, for example, or I don't know. What's required to develop a skill? Practice, time and practice. And knowledge, right? You have to have the information. You have to have the time to practice what it is that we have learned, and then it really develops into a skill. So I think about that as a more of a longer-term outcome or a remedial outcome. If we've changed knowledge and we develop new skills or behaviors, what we hope that happens is that it leads to a change in status, what I would call status. And that could be health, it could be financial condition, social support networks. If we're trying to help individuals, for example, get off the street, it takes time to develop those kinds of robust changes in people's lives. The last caveat that I'll add with this, the farther you get away from the intervention, the harder it is to measure the outcome. There are more confounds, more things that happen in people's lives. I mean, we're dealing with social services. You all know there's 1,000,001 things that we could be measuring that impact people's lives and changes that occur. This is a suggestion about the number of years. I think that this can, okay, we got a question. Let's have a question on that.
And I'm sure you covered it on the first bullet.
Maybe not.
Measurable benefits for participants after TX.
Oh, sorry, thank you. So a lot of times I put that in there as shorthand for intervention. Otherwise, medicine uses it as a treatment. So that's shorthand for treatment. Thank you for asking me about that. You know, see, I do those things. I don't even think about that. Thank you for clearing that up. This timeline is not set in stone. It depends on maybe some funders may have a suggested timeline that these outcomes, they want you to list these outcomes. I think ultimately you have to be the expert on what you think is realistic in terms of your program. Really the kind of questions that we're asking throughout this process, if we're planning an intervention, you know, we're really asking what are the major service gaps? Is there support for this kind of a program? What is it that we need, or what is it that we already have that can support the program? Implementation questions. Are we fully implementing it? That's your outputs, right? Yes, ma'am.
So on the planning question, so really that is really a basic needs assessment, really, isn't that what?
On the planning questions, I was supposed to repeat everybody's question so it gets into the mic. On the planning questions, that is really a needs assessment, absolutely.
And so when we talk about a needs assessment within an agency, like some funders, we say a community needs assessment, and then if you're doing like a basic needs assessment within your organization, it's really just making an argument of why you think that this service should be provided within the organization, correct?
So your question was, if we're conducting a basic needs assessment, either of an individual or within an organization versus a community needs assessment, the basic purpose of it is to identify assets and what is missing.
Within your organization?
Yes, absolutely. Absolutely.
And so that can be done, just so I can make sure I'm connecting that. So that can be done like with a pre or post test, or that can be done with like?
I would say often, most frequently, how we do that in social services is either boots on the ground, people out asking questions about. So I participated in a community needs assessment in Carbondale, Illinois for the development of a community mental health center, and went out and literally asked people what their mental health needs were with a range of questions, a standardized questionnaire across everybody that responded to that. We collected that data, and then we were able to pinpoint exactly what people's needs are. So that could be something, anything from a boots on the ground survey to a consumer satisfaction survey that might indicate some things are missing potentially.
Sure. And that's something you can conduct within your agency.
Absolutely. I think that you could talk to your practitioners within your agency and ask them what's missing. You could also ask people walking through the door who are direct recipients of your services. Okay. Absolutely. I saw a hand go up back there. Good question. Thank you. Any other questions on that? Okay. Implementation questions that we ask, this is where we're using the inputs, where we're looking at the potential activities and we're looking at the outputs and how we can use that information, that data, to drive some of the implementation questions. For example, are activities being fully implemented? This would be, again, an internal question about the services that are being organized and provided to individuals. If you are providing mental health services and you have a specific program that you use, using trained observers, for example. So out at Fulton State Hospital, they provide different kinds of trainings for some of their clientele, and they have direct observers who are trained in those evidence-based interventions to make sure that the providers are implementing them directly.
Can we go back to Nicole's question?
Yeah.
So if we ask within an organization, a lot of organizations within this group have children or serve children. Do we ask, if I was a direct service provider, do I ask if I was Nicole at Boys and Girls Club, do I ask the kids what kind of needs they have? Isn't that a little bit? I don't know that I would ask children, rely upon children wholly.
I think in that case, your direct service providers are good folks that directly intervene with the kids. Maybe parents or possibly mentors, if you're dealing with mentors, might have some needs. I can see in that situation, if you have a mentor-mentee relationship, something a mentor might want to help facilitate the process of helping this child. I think that there could be some relevant questions for kids that they could developmentally answer, right? I mean, we all know our populations, and that has to be a program-specific question. Yes, ma'am.
Wouldn't you want to also develop an inventory of existing services?
Develop an inventory of existing services? Absolutely, yeah. I think that should be a basic program management step, making sure you know what you've got under your belt, under your house, and in the community. I think that ball moves all the time. Do we have those lists? I've not seen those lists in Columbia.
Yes.
Steve? We do. Okay. I think that an implementation program, so is there increased support for the program? So this is, again, is a consumer satisfaction survey. A lot of folks, we've had a lot of discussion in social sciences, are consumer satisfaction surveys outcomes? I think it's dependent upon the service, but asking somebody if they're happy with a service that you provide is a biased response. If they're accessing the service, typically they're going to be pretty pleased with it, for the most part. Especially if they're going to respond to your customer satisfaction survey, because if they didn't like the service and they get the survey, they're going to be like, toss that, right? So are practitioners pleased with the program? So this is what we know about practitioners if they are providing a direct service, is if they are pleased with what it is that they are doing, they implement it with fidelity. When programs, and what I mean by fidelity is they implement it fully. They don't skip corners. They don't cut corners on implementing the program. And if they are pleased with the program that they're offering, they implement it more fully. And if they implement it more fully, it's more likely to be successful. Outcomes questions, I think we kind of covered some of that, but what are the impacts of the program, cognitive or behavioral? Looking at health or economic impacts. Are there dosage or moderation effects? So if we have differences in how practitioners implement the program, if somebody only implements 3 parts of it versus the full thing, is the 3-part version as effective as the full thing? And if it is, why are we doing the full thing? These are the kinds of questions administratively that could be asked of these type of data. Unintended consequences, or what in medicine is sometimes called iatrogenic effects of medications that are taken or programs. We know that a lot of youth services programs that are accessed by low-income kids with what we perceive as behavioral problems, sometimes there are what we call iatrogenic effects with that their peers see them participating in those programs, and it becomes a peer-to-peer issue for those kids to deal with. And then cost benefit of the program. Once we can see what the effects are and we have measurable changes in individuals after they receive programs, we can actually create what we would call an effect size, which is a standard statistic, not hard to calculate. And we can see what that program costs. And these are good administrative information to know when we can see what programs cost and what the actual effects are, help us make decisions. So that was Module 1. Any other questions? Yes?
Okay, sorry.
Oh, it's okay. I want the feedback.
So going back to the implementation questions, So for example, let's say that we know as counselors that motivational interviewing is research and it's a best practice, etc. And there's tons of research on there that we know motivational interviewing works to help clients. How can we ensure from an agency perspective that even though I hired 10 counselors to do motivational interviewing with the clients, how can I ensure that it's properly being implemented in the way that the research indicates that it's actually successful? I think that there's some kind of gap there between the frontliners and how we can actually capture the fidelity of that.
So Fulton State Hospital actually has a motivational interviewing group of trained interviewers or trained counselors trained in that process. And they also have trained observers that sit in and code their behavior. There are specific aspects to MI or motivational interviewing that need to be present in the environment, specific steps to the process. And those observers know what those steps are, and they code the counselor's behaviors and to make sure that those elements are present. You can add each one of those elements up and you can get a ratio. Like if there are 10 elements and you only see 8 present, then you've got an 80% fidelity or an 80% implementation rate. Does that make sense? Yes, ma'am.
This trained observer sounds like a high cost item that I don't believe anybody in our room probably has on staff.
Okay, so checklists can also be used. If you are providing a direct service to a client, giving them not even every client. You could be a random selection of clients. Did you get X, Y, and Z that you know needs to be present for them to have full access to it? So there are other ways. There are lots of different ways to kind of assess this. I don't think there's any one right way to do any of this business. I think that's sometimes part of the problem is it's very loose, but you want to be rigorous at the same time. You want to make sure you're getting the information that you need to answer your question from a reliable source. These are good questions.
Can I just add one thing?
Yes, ma'am.
I do think that sometimes if you try to come up with, okay, this is what I think I'm going to make it like even more. If I say, okay, this would be a great activity to do with the girls in the building, the teen girls, to talk about STDs and sexual activity, right? Some type of an intervention that you're doing.
Okay.
And in my little office, I came up with this like super highbrow, awesome intervention that I think is going to be awesome.
Okay.
What I've learned in the first 3 months of working at Boys and Girls Club when I first started was that I might think in my little office that it's awesome. But when I'll have the outcomes and it's going to be great. But what I've learned, when I take it to Duran, who's we came up with this, it started as a joke, but now we do it actually all the time, where we have like the planners and the implementers is what we call it.
Okay.
So now we have to like present these concepts to the implementers.
So you got administrators and frontline staff.
Like that frontline staff. And the implementers will sometimes say, oh, that's not going to work at all.
I mean, I think that's a basic program development process.
I do, and I do think that is what supports the fidelity of whether or not
yes,
it's going to work.
Involving stakeholders improves fidelity. We do know that.
And I do think that if people see stakeholders as like only administrative staff, you're going to shoot yourself in the foot. So I guess to answer your question, Hein's question about how do we know that things are being done with fidelity on the therapeutic side, all I can do to apply that at the club is that if I don't have buy-in, then it's not even going to take off on the ground. But on the back end is that if they do move forward with it, you can almost instantly tell whether or not you have movement if you're kind of doing that spot checking.
Yes.
Because it even might, when you leave the room with everyone, you may think this is going to be great, and then sometimes it doesn't circle back around to you that it's not going as well as you think it's going to. You know what I mean?
Very true.
You can almost see it with your eyes. I think in nonprofit, there's no way that you can afford to have like the person that comes in, or you know what I mean. Often our research that we find out about whether or not intervention is working is like when I'm getting my hair done at the beauty shop, I hear something people don't realize I work at Boys and Girls Club. I'm like, what is happening?
I mean, a basic thing, instead of me preparing a whole package training to come in here and give you what you need, would be that I would conduct an assessment and involve all of you in the development of the information that I'm going to give to you. Now, that's kind of hard. So what I've done is tried to give a broad overview, and then how many of you in here have I sat down with and consulted with? So far, so a number of you. and some folks that aren't even in this room. And I think that that ongoing coaching is also an important part. Like, we know that about mentoring. Like, we can give kids some information, but making sure that we know that about education too, but making sure they actually integrate it and use it and learn it. We have to coach them, right? And so I think part of that process, what you're talking about, is engagement. And engaging people that are going to be direct service providers or even recipients of that service, and making sure that we're actually meeting their needs. Yeah. Thank you. And I think these questions are going to definitely come up, because and some of this stuff, and we're actually jumping ahead and I'm covering some of the content we're going to talk about, but Sarah.
Okay, just a quick question. And this kind of goes back to what we talked about initially, but since we're trying to adjust our assessments and the way that we track that information, and we were talking earlier about the short term, the interim, and the long term, being able to measure those things over a period of years, one of my concerns is that in the 1 to 2 year, I have assessments that I feel very comfortable because we're close to the mark, and you mentioned this. But the further we get away, the more concern I have with how am I going to know if it was successful or not successful, and it has nothing, like, without all of the other factors that are going on. That child, for example, may have participated in 2 or 3 other programs, maybe with a different family. I mean, there's lots of different issues, and I guess my concern is that since we're trying to improve the way that we're measuring all of these things so that we can show that to the people who are funding us and to see whether or not our programs are really doing what we want them to do, how do we pull those things out? And is that something we're going to talk about later? Am I jumping the gun?
I'm going to kind of address that, but I'll give you a straight up answer. You can't. You can't. You all know this. I'm not pulling anything over your eyes. I'm just telling you that this is what your funders want. They want to see that you're thinking in this fashion. Like, this is the community impact model. The federal government in 1993 adopted the Performance Measurement Act, where the OMB required that every program the federal government was going to fund was looking at things in this measure, looking at things in this way. Increasingly, foundations are doing this. The United Way is not new to this movement. This has been happening for well over a decade. I think that whether it's right or wrong, I mean, that I think is something to still be talked about. But nonetheless, those who hold the purse strings. That's why I say this is a top-down approach. And I don't think that, to your point, they didn't involve the stakeholders in the process of thinking about how we measure these things, or what how it is, why we're doing it. Sometimes we feel like we're creating work for ourselves. Phil.
Maybe I could offer a little more optimistic
Thank you.
perspective on it. One of the things about community impact is that at some point or other we're supposed to lift our perspective up from each of our agencies to the community. And so you may never be able to know whether you're improving kids' self-esteem or you're improving kids' math in the program you're using in your department or your agency actually changes the kid's life forever in their MAP scores. You may never know that. But if you get enough of you for any particular target, you pick a target, children's well-being, getting vaccinated, whatever it is that your target is, and put enough of you together at one table so that if you're all moving on your short-term goals and maybe moving on your interim goals, you'll never know whether you're making a long-run change individually. But together you pick some long-term ultimate outcome, like how many kids across Columbia or across Boone County got vaccinated, or how many are being incarcerated, or how many who get incarcerated never go back. And you start to measure those things. And you'll never know which of you for sure was the cause of it, or all of you were the cause of it. But if you're all working hard to move intermediate indicators, that you know from research, common sense, local experience, you put those together, you say, we think if we move these intermediate indicators, what we think is that it's going to change the long-term trajectory of these children.
It's not only what we think. We do know that this does happen at a community level when we do get organized like that.
So that's the goal, is you all work to get better every year, and we look to see if the needle's moving for the kids in the community.
It's messy.
So 5 years from now, fewer kids are going to jail than there are now.
Yeah. It's complex stuff to try to change things at a community level, especially when we look at all the assets that we have in this community. We know that families who are struggling are accessing multiple services, typically. So you can't untangle those things. It's difficult. Doesn't stop folks from requiring it from us, though. We do have a lot of information to get through, and I want to be able to talk about measurement, but if we want to, and I think that maybe some of these things might also be answered as we go along. Okay. So we've got two broad purposes. There's a handout with a sheet of common language, just some common terms, some things that I will toss out today. But what I will say about this, and this, Sarah, I think goes to your comment, what's really required for cause and effect on proximal and maybe even medial or intermediate outcomes? We must have temporal order. In other words, we must collect some information about the condition or the functioning of an individual we hope to change with our intervention at the baseline before they access the intervention. If we don't understand where individuals are functioning at, we can't make an argument that our intervention changed anything in their lives, right? So baseline is a common term that's used with that. Pre-test, if you're in education, is a common term used with that. We must have association. In other words, we must be able to see that individuals that access the program actually improve their functioning. That's a statistical issue, but we must be able to show that there's a change between pre-test and post-test of individuals that access that service. Sometimes we do that by comparing two groups. Sometimes there are strategies, and I'm going to talk about single system designs of doing it within a group, which is what all of you really are doing, because you're trying to show within your agency that the service your service you're providing is changing people's lives, at least in the initial or the immediate outcome, and hopefully down the road as well. And we must be able to exclude confounds. This is the difficult thing that you're really talking about, Sarah. I think, how do we rule out plausible effects? That's kind of hard, but we do this in one of two ways. That we're able to, over time, use a set of program evaluation methods. And that's why I need to talk about some wonky stuff with research design today, because these sets of methods really determine how rigorous your results are. We use a set or a family of methods to design a study within our agency or an evaluation, and we replicate these methods over time so that we see the same pattern. Just because we provide a randomized controlled trial of a social skills intervention and we see amazing effects with one cohort of kids doesn't make it an evidence-based intervention. And if people call it that, they're wrong. But we need to replicate that in multiple contexts, multiple times, in order to really say, hey, we've got something here. So these family of methods that I'm talking about have to do with sampling, which are the individuals that provide the data, the measurement, which is a primary source of why we're here to talk today about how we measure the changes that we want to affect, have to do with the actual intervention. The important part here is measuring outputs and how faithfully are we implementing the program that we are applying to change the outcome. Has to do with design. Design, as far as we're concerned, has to do with a single system. We are the system. Your agency is the system. Unless you're doing randomized controlled designs within your agency, you don't really have a group to compare it to. So you would give one group the pill, the other group wouldn't get the pill, or they get a placebo, right? And we compare the outcomes of those two groups. We're not doing that unless some of you are interested in that sort of work within your agency. Kudos to you. Let's talk. But I think ultimately what you're trying to do is just show, using program evaluation methods, whether I am achieving the results I want to achieve, at least initially, hopefully longer term. And then analytical, which we're going to talk largely about next time. That's going to be the focus of Module 3, how we analyze and present some of this data. So I'm going to unpack each of these briefly. Sampling, who's your population? It's the people who walk through your door, access your service. That's your population. Now, a sample comes from the population. So if your program is serving 1,000 people, do I have to go out and access all of them? No. But you can access a percentage of them that is at least a fair representation of your approach. So we talked about that, John, last week or earlier this week when we met, about you don't need to have every Boy Scout in your council fill out a questionnaire, or every counselor fill out a questionnaire, but you can pick a representative sample of the children that you serve. Yes?
Well, won't that be biased because you're going to want to choose the ones that you know are happy?
No, you should. So with sampling, I'm going to talk about sampling strategies to avoid bias and deal with bias, because there's a lot of bias in this. If we do not have a fair representation of the children that we serve, there will be bias in the estimates, yes. So there are different ways of thinking about this. Just say you got a list of 1,000 kids that you're providing direct services to. You have it in an Excel sheet in the row next to those children's names. You can hit equal RAND, which is random, and drag it all the way down to the end of your list. Every one of those kids will get a random number, and then you can sort all of those names by the number, divide the list at the point that you say, you know what, I've got enough money to collect data from 50 kids, stop it at 50. You've got a random selection. Randomization is pretty cool. It's like flipping a coin, and it actually works. I've conducted some randomized control trials where I've randomized groups of children into two separate, a control and a treatment group. They're balanced on gender, on grades, on cognitive functioning, on behavior. It's really pretty neat. I'm a dork, but it's really pretty neat. So that's a simple lottery approach to randomization. You can also use a systematic randomization, which might be every 10th case. The problem with this is if you've got individuals listed in your case notes by some particular order, that could be a problem, like birth date, for example. You know, there's a developmental sequence that you are selecting individuals with in a systematic way that could introduce bias. So you can just randomize that list and select every 10th case, or you can just simply alphabetize them by name. There's never been any association shown that names are associated with any bias approach, so that's a way to get around that. Stratified would be that you are selecting proportions. So if you are representing different subgroups or subpopulations within your overall program and you want to know what are the effects of boys versus girls, I've got 25% of girls. I've got the rest are all boys. So 25% of my random sample needs to be female. Okay? And then cluster. If you are like some organizations and you have multiple sites, you need to sample from each of those sites in a random way. So those are ways random sampling within a single system design will help you reduce bias from the information that you will collect. A non-random sample, a convenience sample, this is just folks who come through my door. I'm going to ask them a question today because it's convenient. There are problems with that. The individuals access a service at a certain time or on a certain day. So there are problems with that. But sometimes that's the only thing that we can do. But you should know that there are problems with that. And purposive. This is where we are dealing with small populations. I worked on a research project of heroin users. I mean, not everybody uses heroin, so it's kind of hard to do a randomized sample with that. So you are, and it's a very hidden population. So it's almost a snowball effect where you talk to one person and they say, you know, are there any of your buddies that I can talk to or any of your friends that I can speak with? And they would refer you to somebody else. I mean, there's a systematic pattern to that. But these are small populations and very difficult to get data from. So homelessness is certainly a sample that we would end up with a purposive sample, right? Sample size and power, here's what I'll say about that. I can't give you a solid answer on how big your sample should be. Generally, if you are looking at a single system design and you have some basic needs assessment or you're trying to do a pilot study, I will tell you that 30 is an acceptable number. But if you're really trying to do a program evaluation, take a look at this document. It's from the University of Wisconsin. What I will say about sample is that the smaller your population, which is everybody that your program or agency serves, the smaller your population, the larger your sample needs to be. There's statistical reasons behind why that is, and I won't go into it, but there is a table in this document, at the back of this document, that says if you serve X number of people in your entire agency, here is, statistically speaking, the correct number of individuals you need to have in a random sample. Measurement. Yes, ma'am. I'm happy to go back.
And so,
Oh, do you not? It should be on your. It's not on your slide. Oh, it's not. Okay. You know what, Hani? I did change. I did add a few things since last month. I prepared these slides. What I'll have Hani do is send this out to everybody. All the slides will go out to everybody, so you have these links. Is that okay? Okay. Measurement is basically rules for assigning numerals to objects or events in a systematic way. We've been measuring stuff since the dawn of man. Aristotle talked about actually measuring depression in individuals, talked about how they drank more. I mean, he was making those dots back in his day. The Chinese were measuring all sorts of things. We used to measure stuff with cubits. I mean, a measure is a measure, as long as it's systematic. So we have in social sciences, we have quantitative measures, we have qualitative measures. The basic difference is the quantitative measure is a number. Qualitative measures typically captured in terms of structured interviews, so it's a little bit tougher to make the connections with qualitative data, but I think it's important to collect qualitative data. Quantitative data does not capture all of it. So sometimes if we do a quantitative consumer satisfaction survey to get an idea about needs that are in the community, and we don't feel like we're getting the full picture, we might go conduct some interviews with a sub-sample of our respondents. What I'll say is mixed methods is becoming more and more popular. So that might be that I've got a list of some quantitative questions that I want you to respond to, and then I've got a few I want your opinion questions. And I think that the approach that you use depends upon the question. There's no hard, fast rule for this. I think that when we know something about a concept or an outcome, a lot of people have studied it. We know the highly associated conditions or indicators of that outcome, and generally they can create some pretty accurate quantitative instruments. If we don't know a lot about a condition or an outcome, a lot of times you're going to have to use qualitative approaches to try to answer the questions that you want to have. Yes, ma'am?
Can you provide an example of how we would do this if you used any one of the agencies within this group?
Sure. I think that, for example, if you wanted to know, I had a question about homelessness, maybe a program outcome about homelessness, that is not always easily captured in a quantitative measure. You know, I provided you with X number of days of living support. What kind of positive changes do you perceive have occurred in your life? You know, you collect this across 10 individuals, and you can see that there are some common trends there, and that might be an outcome of interest that you would want to focus on quantitatively speaking. You could develop a question that might tap that in a quantitative manner. Does that make sense?
What if you have multiple interventions within the same program, and how do you really determine which one is going to be?
Oh, I love questions like this. They are complex and statistically dependent. You have to measure fidelity across every individual. You have to measure the dosage of the program that they receive, and you can statistically model it, and it's pretty neat stuff. And then there's a whole science called implementation science that is looking about what I would say is the concatenation or the collection or the integration of multiple interventions. This is the frontier of where we are going. What you all are doing in this community is really putting multiple interventions around a population who's high at risk and trying to see if there's a positive outcome. And there are ways to try to tease some of that apart. It's complex. I'm not sure that, you know, it's not clear. There are ways to tease it apart. It is, statistically speaking, hard, though. Measurement is the first step of trying to tease that apart. If we don't measure the outcomes associated with those programs and the actual implementation of the program, then we can't even begin to answer the question. So I think that what we are doing here is starting the process of trying to understand that. Yes?
Thinking about what you just said, what Phil said earlier about this being a community-wide effort, how reliable is the data going to be from individual agencies who are doing different things to measure what we're looking for, which will be a community-wide kind of impact? Does that make sense?
Yep, it does. So I think there's a different discussion about this. Steve and I have talked about this on a couple of occasions, Hani and I as well. We've debated, and it is a good argument I think that we should all continue to weigh in on. My feeling about the long-term outcomes are really community level. I mean, this is, I think, like what Phil's saying, if we all try to pick some relevant targets in our community that are highly associated with poor outcomes for folks, and we really try to concentrate our efforts, that we will move that community level needle. But I think that you, as a program, ought to be able to select initial, like immediate and intermediate outcomes that you think are relevant to your program. So everybody can have a flexibility around those initial outcomes that they're measuring, but what we hope to achieve is a community level impact. A movement of the target, for example, under the United Way's 4 impact areas, they've got 3 to 4 targets per impact area. Did I say all that right?
I think so.
Okay. Does that make sense? And I think there's debate. There's still, I don't think there's a clear answer on this necessarily, but I think that is the general thinking about how this process works.
So our primary focus should just then be the immediate and intermediate. I mean, do we need to come together and come up with a? I mean, if the
I would like to engage all of you on that question. Yeah, to talk about engagement. I think that all of you need to be involved in that process about how you measure this. But definitely, yes, the initial is certainly what you expect to change at the delivery of the program or service. The intermediate, what you would hope to be the next step. I mean, and it doesn't necessarily need to be 2 years. It could be within 3 months that we're seeing this change.
Yeah.
And it's program specific.
Okay, because when I look at the logic model, I'm thinking of in terms of my program.
Yes, you should.
Okay.
That is
Make sure that's
it's a tool that you should be able to wrap your own program into. It should be very program specific. But what we're aiming at long term, I think, correct me if I'm wrong, is a community level change in homelessness or income indicators or whatever. Yes, ma'am.
And what's missing? And what's missing in the community? I mean, we have a lot of interventions to help kids and families once they get in trouble. How much is really there to help support them?
Prevention?
Right, in this room, and isn't that really where we need to go? And who's
Eventually, yes,
do that,
it is.
how do we collaborate and get funding?
We are not a very prevention-oriented society, even though the science suggests that prevention works to prevent people from falling into conditions that are highly associated with bad outcomes. We can do a lot at the early childhood level. If it was up to me, we'd target everything at early reading interventions and home visits for low-income parents and single moms. We know that those things can change children's lives. Oh, you get me excited. All right, we do need to move here. I don't want to leave you hanging with 10 slides left. Interventions are programs, policies, treatments, strategies, also called procedures or practices, highly associated with creating buffers or supports around individuals that are having trouble in a specific area. What about evidence-based practice? Evidence-based practice, take this to the bank if you've heard anything different, is a process. There are no evidence-based practices. It's a 5-step process that we go through. It's a decision-making model. I've got a problem. What's the best solution? Or what are all the possible solutions? What's the best solution? I'm going to implement that solution, and I'm going to evaluate that solution. 5-step decision-making process. If anybody says to you that there's an evidence-based process, if there's an evidence-based practice, if they use that in that term, that's not what we think about evidence-based practice. It's a daily, continual process that we engage in. When the client walks through the door and they've got a different problem from anybody we saw before, we can apply that 5-step process and come up with the most optimal solution for that particular client that suits their needs. A lot of folks are doing, Love Inc. does some very intricate, individualized based interventions. You can't pick an evidence-based practice per se, but you can apply the process to help come up with the most optimal solution. I see a lot of confusion around some of those terms, and I wanted to clarify that. But there are evidence-based interventions. These are packaged interventions, social skills interventions, educational interventions. There's been a whole market driven by No Child Left Behind, billion-dollar market of folks that are creating single programs that we then apply in schools, and we pile on top of each other, and we don't have any idea what the effect of one is over the other. Typically, we call it an evidence-based intervention or program if it has been replicated multiple times in tightly controlled randomized trials, that it's been implemented by different developers or different investigators or researchers, so across different contexts, we see some similar outcomes. I think when we see that across individual outcomes over different examples, we can say we've got something. This is evidence-based. It's not one study, it's not two, but multiple studies. I don't think that there's a number that says, after 5, we've got an evidence-based program. It's not like that. And then fidelity, I've talked about that, but really we're monitoring those programs. So you asked the question, we don't always have observers. That costs money, absolutely. There are different ways to think about monitoring fidelity or implementation of a program. We can look at the quantity or the number of units that are served. We can count. If we have a program, you should be able to think about what is it that needs to take place for this program to be fully implemented, give it a unit, a number, and then count those things across the individuals receiving them. There were, like 7 or 8 skills that children need to learn to get their health merit badge for the Boy Scouts. Counting each one of those skills, if they are proficient in them, shows full implementation of the program. Quality would be more of an observation of somebody coming in, watching systems and how things or how programs are implemented, and saying, yes, it's being fully implemented or it's only being partially implemented on some sort of scale. Design, broadly speaking, there are 2 different kinds of designs. There are group designs. That's where we compare one group against another. I think the programs can use this. For example, let's say at Great Circle we are looking at adopting a new program. Alongside, there's some new evidence to suggest a new approach might actually be a better approach at addressing something we were trying to target. So let's try a pilot. Let's implement it over here with this group of kids, and then let's compare it to business as usual or what we're doing right now. So that would be an interesting within program way to try to understand whether one outcome or one approach might be more effective than another that we're already currently implementing. So that might be a within group design that I could see you using as a pilot, kind of. Typically speaking, though, what we end up doing are single system designs. This is how we, within our agency, or really within an individual can be a system, or our agency can be a system. Our community, if you ramp it up to that level, is a system. But the basic requirements of single system design is that we have well-defined outcomes that are directly connected to what it is that we want to achieve. Our program activities should result in those outcomes. If we are teaching, we should have an outcome that looks at collecting pretest of the information directly taught. If we are providing counseling services, we should be looking at outcomes of functioning associated with the kind of service that an individual comes in and seeks for it. We need a baseline assessment of the individual's functioning. This is basic stuff. We have to show, in the elements of causality, we must show where individuals are functioning before they have access to the pill, which is our program or our service. We need full implementation or monitoring of the implementation so that we can understand whether it's being fully implemented or not. And we need to assess the same measure or metric that we assessed at baseline after the intervention is allocated. We demonstrate change by comparing the pre-test and the post-test and looking at the difference score, how much we moved their score. So briefly, single system designs. Typically how they're talked about in research, we just use some notation to say this is baseline and this is intervention. So baseline indicates an assessment, which is both pre-test, post-test. Anytime you collect a measure, we typically talk about it as an A. An intervention could be a B, and we might have multiple interventions. So we could go on to C, D, E. But we have some basic permutations of this process. A pre-test only is an A-B. The problem with that is what? If we only collect a baseline before we give the intervention, what are we lacking?
Result.
A result. We don't have a way to show that we've made a change. We can suggest that we saw maybe qualitatively some changes, but no data is collected. Post-test only, same problem. We don't have a baseline to compare our post-test to. Pre- and post-test is where we start getting at what I call internal, or what researchers call internal validity. There's enough internal study validity In other words, the elements are present for us to make some causal statements about the impact of B. Withdrawal designs are introduced and this is not always appropriate with individuals seeking social services. So if you're providing homeless shelter, you don't withdraw the shelter from people. But if it's a condition that you want to know if it's working and it's feasible and it's ethical, this is a way to introduce greater validity. You can associate the change in the measure with the withdrawal of the design, or the withdrawal of the treatment, sorry. And so that design feature actually helps you isolate the effect of the treatment better. It gives people, when you show them this graphic that I'll show you in a second, you can say, aha, that's an aha moment. Alternating treatments would be similar, but with a different program approach.
Would withdrawal treatment be the same as, like, say your program lasts for, 6 months, and then when the program is completed after that 6 months, if you were able to go and take an assessment, say in another 3 months or 6 months, would that be the same thing as withdrawing treatment when the program completes?
No, I think that's what's called a follow-up measure.
Okay.
Yeah, so when follow-up measures are important too. I think you can add as many A's on the end of receiving a program as you'd like to look at outcomes over time. What we know about the baseline is if we can have 3 to 5 observations, that increases the validity of the data that we're capturing. The trustworthiness of it when I say validity. We can see patterns over time of the individual's functioning. That's not always feasible or ethical in the services that we provide to say, hold on for a second, I know you need alcohol treatment, but I need to catch a couple of weeks worth of data from you. It doesn't always work with what we do. But what we know is if we can do that, if that is feasible, and that provides individuals who look at our data a little bit more trustworthiness in what we've captured. We typically show this change in very simplistic ways. I think the simpler that we can present data, the better. We usually do this with acceleration lines and graphics, with time on the bottom axis or the horizontal axis, and the outcome on the Y or the vertical. So some examples. This is my A-B only. You can't really make any causal statements about the effect of the treatment, but we can see that during treatment, whatever we were measuring appeared lower. Here's where we start getting at a little bit more stronger internal design that allows us to make some causal statements about post-test functioning. When the intervention was over, functioning still was below baseline, but we did see an uptick. Administratively, I'm going to say, well, maybe we should look at a longer implementation, or maybe we should look at a booster session. So withdrawal design, obviously these are best case scenarios. Not all data looks like this. But you get the picture. This would be an ABAC, so where you would have maybe 2 different interventions that you might allocate to one individual person or across people. Some of the threats to measurement in these designs, repeated measures. We're capturing repeated measures from individuals. Instrumentation fatigue is an issue. If possible, the way you can remedy this is to triangulate or capture a multiple measure from maybe another source or use another indicator. Not just one measure of an individual's functioning, but maybe give them 2 assessments potentially. Does that make sense?
Yeah.
I mean, if individuals respond to the same question over time, they get used to it. They start to predict what their score is going to be. It biases the results, right? We can conduct observations too if we have those resources available. That's another way. History effects are also a concern with single system designs. In other words, policy changes within your organization or changes within the implementation of the intervention itself affects the outcome. So any kind of history event that would alter the results that we're trying to measure is just something to be aware of. You can't fix all these things. I just want you to be aware of them. And conclusion validity is also a concern. Conclusion validity is really what I'm referring to when we say we've got these data, I've graphed it, we're going to draw these conclusions, be careful not to overstep the boundaries of the data. What are the data telling us? They don't necessarily give us causality. We can't say that A caused B, but we can say it's associated and we see a pattern. And let's look again, and let's look again. It's a process. It's also affected by the kinds of measures that you use, whether they are accurate indicators of the real outcome that you want to assess or achieve. So what is reliability? This is a concept that is somewhat painful, and I'm not going to delve into it too much. But there are several. Reliability really refers to the accuracy of, or the consistency of a measure. Validity is the accuracy of a measure. So reliability is consistent. Does it consistently perform over time? There are several sources of error in all data that we collect. Everything has error. Somebody marked the wrong question. Somebody had a bad day on the way to the training and marked the wrong. You know? If you ask somebody about social history, they're going to have a very different response if they didn't get their coffee that morning. But then there's also systematic error. That's a measurement problem. Systematic error is occurring across multiple people. Random error washes out in the averages. When we aggregate all that data up to 100 people, 1 or 2 errors, it's not really going to make a difference in the average. A systematic error makes a difference. So having good measures, which you will produce over time, or selecting one that's already been developed by researchers and tested, and we have an understanding about how it operates, will increase your reliability. I will say that. For evaluation purposes, there's one indicator of reliability that I want you to be aware of. Cronbach, what we call Cronbach alpha. It is a correlation of all of these items and how highly they are correlated across individuals. For evaluation purposes, a 0.7, so a correlation goes between a 0 and a 1. A 0.7 suggests that it's fairly reliable. For diagnostic purposes, we usually require a 0.9. And real quick, I mean, this, I did kind of put together a handout. There's a lot to know about internal reliability and validity. And you're not researchers, and I don't think you need to know any of this. But take a look at this handout that I guess it's not popping up. There's a handout that kind of provides you with a schematic of all these concepts of reliability. And I read through it. I tried to put it in some pretty common language. Common concepts. So it's this here. There are 2 sides of it. Basically, I'm taking you from the measurement, the operationalization of what it is that you want to capture. Operationalization just refers to, I'm concerned about depression. Well, what does depression look like in the environment? How can I observe it? How can I measure it? It's just transferring the concept into a measurable entity or indicator of the outcome that we want to achieve. So, depression, you've got multiple indicators. If that's what we're interested in, we've got what? Lack of appetite, sleep patterns, mood lability, right? We got look at the DSM. There's about 10 of them on there. You need to have 7. And if you're depressed, then go see somebody. I hope that the handout is helpful. I don't want to focus on it too much because I really want to get to talking about some measures. SMART outcome criteria is what the government has turned to, a lot of foundations have turned to help people write goals that are achievable, measurable, relevant, and be specific about those things, and that there's a time limitation on them. All of these criteria for a goal are important. For example, a student will increase basal letter recognition scores from their current performance by 10 percentile points before X time period. This is an IEP goal. Measurable, time-bound, specific, and certainly relevant to that child. But I think there's a lot of things we need to keep in mind when we're selecting measures for our agency. I mean, again, this is a top-down approach, and we need to make sure that it is directly applicable to answering some questions that we want to know about. Man, we catch ourselves trying to collect a lot of data. And, you know, I'm sitting around a table sometimes. I mean, I've had this conversation with Boy Scouts. I've had this conversation with Great Circle. Why are we capturing this? I mean, I think that there's a story to be told about the effect of what it is that we're doing. Man, I took a look at the Boy Scouts handbook. It's a pill. Like it's a whole curriculum on how to teach kids healthy behaviors, and this is important stuff, especially in the age of where we're trying to reduce obesity among children. It's a problem. This is an epidemic. We need a pill. They've got a pill. But how can we measure the effect of that is the question. How can you demonstrate that to not only the kids? I mean, they're capturing data like heart rate, like BMI. If you can use that data to inform your client that, hey, after 6 months of working on this curriculum and doing push-ups and walking every week, your BMI has moved this much. That is powerful feedback for your client, for that child, to see that that is happening. That's one way of thinking about using these data. Look what we're doing. The other way of using it, of course, is to capture some money so that we can keep our budgets and our programs going, so we have to appease funders. I don't think we have to capture data just because funders want us to, but it should be relevant also to what it is that we're doing. It needs to be easy to administer. You know, you guys do a million things in a day. But thinking about, for example, how you might just quantify 1 or 2 things that you're doing that are highly indicative of the changes in the outcomes you want to achieve will help you do that. So it should, for example, met with Love Inc. last week, and really we tried to look at what it is that you're currently doing, what data are you currently collecting, and how might we alter that or transform it into a quantitative number to see whether you're making a change over time within individuals and across your organization. There's some tricks to that. It needs to be reliable or accurate. It needs to be an accurate indicator of the outcome that you say you want to achieve. It needs to be sensitive to change. So some questions will ask you about status. Have you been arrested in the last 6 months or not? That's a 0 or 1 question on a questionnaire, right? There's no variation. There's no chance to really change if you collect data across 50 people on whether you've been arrested in the last 6 months and all you've got is a 0 or 1. You're not going to see a lot of change across those 50 people because you've only got 2 response options. But if you have several indicators about criminal behavior that you might capture, or about have you had any police contact, have you been arrested, self-report on criminal behavior is not real reliable, but it suits my example here. Self-report on drug use is not real reliable either. So. It needs to be inexpensive, and I think if it's easy to administer and it's useful, it's going to be inexpensive to you. How many indicators? I think that's a program-specific question. Typically, you should have maybe 1 to 3 for your per outcome. As we get farther away from the intervention, it's harder to assess it. Definitely for simple and immediate or proximal outcomes, 1 indicator can be enough. For complex and medial outcomes, having a couple of them will give you multiple chances to show that we've got change in those areas. Measurement level questions are also something to be considered. One of the things that I think that we have a real hard time about with this immediate, medial, and long-term outcome is that we are asking you, providers, to assess what it is that you're doing. We can't apply a community level metric. That's a different level, right? Like that's almost unfair. What we hope is that multiple people pitching in and addressing a targeted problem does move that indicator. It is a hope. But that's the theory. It is a theory right now. I would even add that. Wouldn't you say so? It's also important to recognize measurement level. Again, I think this has to do with some properties of your measurement tool or instrument that you're using. Nominal, you're not going to get a lot of information out of. Really nominal data has to do with what's your religion, with what sex do you identify with, employment status. It's a 0 or 1. It's just who are you? Demographic information largely. Ordinal, there's a ranking. These are your Likert scales. We can't really tell what's the difference between you and I on somewhat and often, on a Likert scale. But there is an ordinal or a hierarchical relationship between the data. We use Likert scales a lot in social services. and we treat them as their interval, which is a dirty little secret of social scientists. But interval measures, like an achievement score, there is an objective difference between a 0 and a 1 on an achievement score. Like, we know that 2 standard deviations is a great improvement, or wow, this kid's really sunk back. And we can all look at it and agree on it. And ratio is an objective difference with a 0 starting point. So that's actually like a place that the measure starts from. And we can have that with age, salary, although some of us may go into debt, and that's arguable. We might go below the 0 point, but the 0 point is still the starting place of the measure. So those are different quantities. By and large, what you're going to ultimately end up capturing, certainly this, with your everyday question of who you are, you're going to capture a lot of that data. That's going to be your output data. You're going to capture some ordinal data, and you're going to maybe interval. I would say that interval is preferable because you get more variation in that data. There's more variation or opportunity to change. It's more responsive. Like, if we have an intervention and we are trying to measure individuals on a 250-point scale, there's more fine opportunities for individuals to move around on that scale than there is on a 4-point ordinal scale. That makes sense? Yes, ma'am.
So going back to your pre and post, what level of measurement is the variable ethnicity?
Ethnicity, it's a category, it is nominal. These are categories. Were you quizzing me? Did I pass? So relevant sources for locating some measures. I would say start with Google Scholar if you're looking for anything associated with what it is that you're trying to change. I would say you need to know a little bit about how researchers talk about your specific area that you're trying to, that your intervention is in. They're going to use specific search terms. Most of you are probably well aware of just looking at the literature there. Becoming familiar with professional journals, just looking at research articles, maybe even seeing what kind of measures researchers use to measure change on participants in those studies might be applicable to your agency. I'm not saying you have to purchase the measures, because if you look a lot of times at dissertations and abstracts that you can find on Google Scholar, you might be able to borrow some of those things and maybe reword them so that you're not copyright infringing. I had to add that last part for the camera. Look for compendiums. So these are organizations. So for example, they will take an issue or a population that's facing a particular problem, and they will list every single measure that taps that outcome or is relevant to that population. There are ones out there for social emotional health. I found some on mental health. Once you just start Googling, let's say, insert relevant outcome and then compendium, you may find that. Governmental organizations create these compendiums. I'll send this out. There are hot links embedded in this PowerPoint, and there are some interesting compendiums in each of these. I don't know if the link will, they will pull up. So here's a compendium. It'll give you a lot of information about the methodology, about various domains, so outcomes that you might want to check out, for example. And then it will go through each one of these specific measures that are existing. Try to find, it'll give you some costs. Is there training associated? A lot of information that's very useful in developing a grant application.
Does that come in a cliff note?
Does that come in a cliff note?
That's 315 pages.
It is. I don't think you have to read the whole thing, but looking at the table of contents, finding the measure. I'm just saying, I think that a lot of this work has been done for you. I just want to show you the resources that are available, because sometimes this is a little bit of a labyrinth. We're looking for this information, we don't know where to look. Again, these hot links will come out when High sends out the PPT, but here's a couple of test reviews. If you're wanting to find standardized measures that are already in existence, I don't want to create something. I want something that's been created that's highly reliable. You can find reviews here on on almost every commercially available social outcome that we have. APA has some frequently asked questions on locating measures that you might check out this link and just read a little bit. How can I find this or that? The American Evaluation Association is also produces a lot of reviews on measures. And a lot of these measures are used by social service agencies. I know I'm kind of running short on time. If you can bear with me a couple seconds. Also check out, there's a book called the Measurement Reference Book. So the Health and Psychosocial Instruments is a whole huge text. It's about 4 inches thick on any measure listed by domain. It's updated annually. This is the Mental Measurements Handbook, or Mental Measurements Yearbook. It's updated yearly as well. Same thing. Developing your own measures. I would say if you can avoid it, don't do it. If you must, develop your own psychosocial measures. Think about a stepwise process. Determine what it is that you want to measure. Take a look at all of the available literature and maybe ways that people ask questions about those issues. I sent you a whole bunch of studies and measures on looking at your homeless program to kind of give you some information about things that you might be interested in looking at. Familiarize yourself with them. Try to pilot test some of those, putting together a questionnaire. How's this working? And just pilot test it. Maybe ask colleagues to review it, people who work in your area. Engagement building, of course. You might need to refine some of the language if it's not appropriate for your population in some of those instruments, right? I mean, this is a stepwise process that folks go through to develop existing measures. I only offer it as some suggestions. If you have to do that, these are some things to consider. This development guide is super helpful from Johns Hopkins University, and it will also give you probably more information than you want on the subject of creating your own measures. Okay, so we've got a grant. We've got a logic model. We have a grant that we want to apply for. How is it that I connect my measurement model to my logic model? Thinking about the developmental process of your outcomes. This one is, I believe, maybe Buddy Pack. Thank you. So some of my students did this work. They created a logic model around Buddy Pack program. The activities that are being used to implement the program itself, the number of outputs that we can count over time. And again, I'm not being specific here. I mean, somewhere in your narrative, you need to say, we expect to serve X number of kids, right? But I think for the logic model, it's a simple list or list of things that we are going to capture. And then listing our relevant outcomes. Using this language that we provide in the outcomes, you can create a measurement table. This looks messy, I will agree. And what I don't have actually is off to the side over here. I have the actual language that I used in my outcome model, or in my logic model for the outcomes. So increased student and school bonding, reduced child stress. I'm using reduced stress and I'm measuring it by a Beck depression inventory. And here's the information relevant on the reliability of that measure itself. So just try and connecting the two by using common language and then walking through it in your narrative. Top down. Linear form helps reviewers when they're reading it connect what it is that you're wanting to measure to how you're actually going to do it. Does that seem useful in terms of just linking these two tables when you think about writing grants and proposals? Sometimes this stuff gets lost in the narrative.
But you didn't have an outcome. Well, you didn't have the measurement on the increased student school bonding.
Yeah, that's my oversight. Thanks for pointing that out. I make mistakes. Yeah,
I just wanted to clarify.
Yeah.
I mean, for everything you list, you need
You need, if you're going to measure that outcome, you do need, yes, bad example, bad professor. I did not list the school bonding, and I knew that actually because I was running out of time, but I thought maybe it would slip by, but you guys are sharp, I tell you. So yes, everything you list in your outcomes model or your logic model for outcomes needs to be presented in this sort of format. and then you talk about it in a linear fashion in your narrative. I know, Hani's giving me a look over there. I wanted to do an activity which we don't have time for. I would just say, bottom line, really take a look at what data you're capturing, how you can maybe quantify some of that information to reflect the outcome that you want to achieve. Don't start doing something new if you don't have to. Start simple, pick one or two outcomes, and try your best to capture the relevant information that is reflective of what it is that you want to communicate. Keep it simple. Start with one or two, and then build it over time. You're not going to be collecting any medial data, so if you're trying to support a program right now and you're starting this process, that's fine. Get a solid plan in place to capture one or two immediate outcomes. Refine the other process later. I think as you collect those immediate outcomes, they will suggest that I need to look possibly at this as an intermediate outcome. It's a process that will inform itself. I had a few other slides with some caveats to some of this. I'm sorry I couldn't get to all of it. I am happy to meet with any and all of you, and I'm loving every bit of this. So please contact me, and I will try my best to meet your busy schedules. Thank you for your time and patience today.